99. 99.
I'm going to come in from the side first. And squeeze all the way in. Good. Just going to test some mobility here at the elbow as well. That's good. Hi, Samantha.
Hi.
How's it going?
Good, how are you?
I'm doing well. Thank you so much for asking. It's nice to see you in the office today. So obviously you've been here before for your annual visit, and it looks like you're back in today for a checkup.
Yes.
Okay. So are you feeling pretty well today? Okay. I didn't see anything specific. There was nothing in your notes that looked like you were concerned about anything?
No, not today.
No changes from your last visit, really?
No.
Good. Okay. Well, if you're feeling generally well today, not in any pain or anything, we can go ahead and get started with your examination. It's going to be similar to your last annual visit, just kind of doing a once over, having a look at you. I'll have you perform a couple things, have a look kind of head to waist, make sure everything's working okay.
Okay.
All right. Okay. So let's go ahead and get started. I'm going to have just a look with my pen light as usual. So I'll ask you a couple questions as we kind of move through the exam. You don't have to look at the light just yet. Okay. So have you been experiencing any headaches recently?
I had one yesterday, but I think it's just due to a lot of noise.
A lot of, okay. So were you at like an event or anything?
Just general chatter.
Okay, I see. So just sensory overload maybe. Okay. And prior to that, have you been having any frequent headaches?
No.
Okay. All right. Any changes to your vision?
Mm-mm.
No. Have you seen your dentist since your last annual checkup?
Yes.
Okay, good. No changes with your oral health?
No, all's good.
Have you been maintaining physical activity?
Mm-hmm.
All right. Any changes to your employment? Are you at the same job? I know your job was pretty physically active.
Same place.
Okay. All right. So externally, I'm not seeing any changes. Skin is clear. Complexion is normal. No noticeable changes to your hair. Very long and healthy. I will have a bit of a look at your scalp in just a minute. Did you have both of these piercings at your last visit?
Yes.
Make sure there's nothing going on there. They both look okay. Alright. And I'll just have a look at your arms. Skin complexion is clear. We're moving into the colder months, but I still recommend that you keep up with your sunscreen, skin protection. Just have you flip your hands over for me. So no noticeable abnormalities with skin texture. I'm not seeing any normal redness. Some pinkening here, which just indicates adequate blood flow. Okay. Very nice nails, well groomed. Are these artificial nails?
No, they're gel, so
Just
it's
gel.
just
Okay,
on
so
my
just
real nail.
gel polish. Okay. All right, very good. And no issues with your lower extremities, feet, and everything are okay?
No.
Good. Okay, very good. So my external examination is pretty normal. I'm not noting anything that I would think is particularly concerning. So we can go ahead and move on with something a little more in-depth. Now, I am going to go ahead and get a set of your vital signs, if that's all right. Let's just test for a couple things here. I'll start by placing a pulse oximeter on your finger. And we'll get this plugged in. So I'll have you stick your index finger out for me. Very good. And this is a little loud, I apologize. It's a newer cuff and the Velcro hasn't quite worn down yet. So go ahead and place this on your arm here. It's going to feel just a little bit tight. Okay. There you go. So I'm just going to come over on this side here. I'll have you uncross your legs for me. All right, so I'm going to place this at your inner elbow. It is kind of cold there. And I'll have you just relax your arm for me. Perfect. Okay, you're going to feel a slow release. Good, good. Okay. So blood pressure is right about 120/83, which is perfect. All right, so let me just check your temperature here. I am going to check it 2 different ways today just because it is your first visit within the last year. So I'm going to do an oral temperature. Hopefully, if I can. There we go. So if we stick this under your tongue, that'll take just a minute, and while that's reading, I'm going to go ahead and check a temporal temperature as well. I like to check around the lymph nodes, see if there's any signs of swelling or inflammation there. Good. Okay. So we are at an average about 97.2, both oral and temporal. Have you had any colds recently? Cold, flu this year?
No, not yet.
All right. Okay, so go ahead and put this back. And oxygen saturation was also within normal limits. So that is very good. So no issues with your vital signs. And I don't have anything in your cardiac history, so that's great. Very consistent. Semi-unrelated question. Any changes to your diet pattern? Have you changed dietary restrictions or anything like that? No new intolerances or anything concerning? Good. And how has your sleep been recently? Are you sleeping 6 to 8 hours a night?
Yes, but like it's been on and off. I think I just keep hearing noises in the night, so it's waking me up.
Okay. So some difficulty sleeping. All right. Do you sleep with like a sound machine or anything?
No, just the fan.
Just a fan. Okay. I also sleep with a fan on. Okay. So we might have some recommendations that can help you with that just a little bit. About how many hours on average would you say you're sleeping?
8.
How do you do? Okay, so not terrible. Just maybe some trouble throughout the night.
Mm-hmm.
Okay. So while I have my stethoscope out, I'm going to do a little bit of a heart and lung assessment, okay? Okay. So again, this is just a little cold. All right. Good perfusion on the right side. So you sit up straight for me. Okay, heart sounds good. I'm going to come around and listen to your lungs.
Okay.
Thank you. Okay. So I'll have you start by just breathing normally for me. All right. So you're going to feel a gentle tapping on your back. When I tap, I'd like you to say 99 out loud, okay?
Okay. 99. 99. 99. 99.
Okay, all right, very good. Okay, so no abnormalities with your lungs. That last test just allows me to listen for any possible fluid of the lungs, which wasn't audible today, so that's very good news. Okay, so now that your vital signs are done, we can go ahead and move on. And I think the next thing I'd like to do is just a very brief look at your eyes. Have you seen an optometrist recently? I know you don't usually wear glasses or anything.
I have contacts in.
Contacts, okay. And no changes to your vision?
No.
Okay, still seeing at night okay?
Mm-hmm.
Okay, so I'm going to start by shining my light in your eyes. You can just kind of look forward for me. It's going to be just a little bright. I'm going to come in from the side first. Just checking for your pupillary constriction and dilation, which just means I'm looking to see how well your pupils accommodate to the light. So when I bring my light in, your pupil should constrict and dilate accordingly. Just going to test that individually now. Sorry, I know it's a little bright. Very good. And if I restrict both eyes from the light. Very good. Okay. So the next thing I'm going to do is have you do a brief follow the light test. So it's going to be a little bit further away from your face. I want you to try to keep your head still and just follow with your eyes. Very good. And follow it out for me, and follow it in. Very good. Okay, good job. No issues with that. I'm going to give your eyes a little bit of a break. And we'll have a look at your ears. So you said you've been having trouble sleeping because you're hearing things at night. Any other changes to your hearing?
No.
No ear pain, abnormal ear discharge, or
Nothing
anything
like that.
Okay. All right, so I'm just going to have a look in your ears for me. I'll have you turn your head just slightly. Okay, so ear canal is very, very clear. I actually don't see much earwax at all, and tympanic membrane is visualized. No signs of tear or anything there, so that looks good. Very clear, almost abnormal that there's no earwax at all in there. So have a look at this side as well. Okay, it's the same thing on this side. I do actually see just a little bit of pinkening at the left upper corner. The tympanic membrane here. No pain or anything in this ear?
Mm-mm.
Okay, so it could just be an anomaly. There was just a little bit of red there, but that's okay. As long as it's not bothering you, you're not feeling any pain, especially if you see fluid that doesn't look like earwax come out of your ear, that would be concerning, but all of that looks okay. All right. So how are we doing with your nose? No changes to nasal patency, no seasonal allergies, no stuffiness or anything like that?
No, nothing like that.
Okay. So I'm going to test by just occluding the side here. I'm going to have you breathe in. Good. Same here. Very good. So no issues with that. And very briefly, if I could have you open and say ah.
Ah.
Stick your tongue out and lift your tongue to the roof of your mouth. Very good. Okay. All right. Oh, that looks good. So we can go ahead and proceed. Why don't we test your reflexes since I have you seated. So I'm going to start with upper extremity here. So I'm going to have you just relax the weight of your arm here for me. This is going to be just slightly uncomfortable. Good. Okay. Good. And then we'll test here at the second digit. Good. Okay. Same thing on this side. Just relax your arm for me. And I'll have you uncross your feet for me and just relax your legs. Good. Very strong lower extremity reflexes, and I'm just gonna test out the ankle there. Okay. All right. Feeling okay so far?
Mm-hmm.
All right, Samantha. So in line with your reflexes, I'm going to test your facial reflexes, and you have several. So we'll start here. I'm going to have you open just kind of loosely for me. Good. Do you ever get any pain of your jaw?
Not really.
No. Any grinding of your teeth at all?
That I do.
Okay. Do you grind your teeth at night?
Yeah, I'm trying to stop. But
Okay. It is kind of a hard habit to break. Would consider something like a mouth guard if you feel like you're really struggling with it, because it can start to affect your jaw structure as well as give you kind of that migraine feeling. Okay. So I'm going to test your pupillary reflexes. So essentially I'm just going to bring this to the corner of your eye and I'm going to try to get you to blink. I want you to just kind of blink naturally.
Okay.
Okay. So I'll have you look forward for me. Good. And inner tear duct. Good. And right over the lashes. Very good. And we're going to do a bit of a tapping test. So same thing, this time I'm just going to tap with my hammer. Okay. Very good. Very strong blinking reflex there. So at this time, I think I'm going to have you lay down on the table. I'm going to have a look at your skin on your face, as well as your hair. I'll have a look at your brows and lashes as well.
Okay.
And then a bit of a closer look at the skin of your upper extremities there.
Sounds good.
Okay. All right. So go ahead and lay down for me in a position that's comfortable for you. All right, Samantha, are you comfortable?
Mm-hmm.
Okay, perfect. So we are going to go ahead and get started. I'm going to do a bit of a skin and scalp inspection before I move on to just have a closer look at your arms. So I'm just going to look around here. Let me go ahead and put on a pair of gloves just since I'll be touching your face. Any changes to your scalp or skincare routine recently?
No.
Alright. Let's start by just having a bit of a once-over here, looking at skin on your face. Nothing notable with the naked eye. Doesn't appear to be any active blemishes. I do see a small scab here at the cheek. I'm going to use my pen light to have a closer look at your ear piercings. Okay, so they do appear to have healed quite some time ago. I'm not noting any discoloration or abnormal discharge or anything here, so that's good. And the external ear itself is very clear. You maybe see some just mild debris at the external ear, which is totally normal. Look at the other side as well, so I'm just going to have you turn your head for me. Perfect. So same thing, I do see just a little bit of that. Looks like just some dead skin there at the external ear. So I'm going to shine my light over the brow bone here. Okay, so shining my light right over your eye, and just keep your eyes closed for me, having a look at the lashes, as well as the upper eyelid and lower lid as well. Just gently pull down here. Also going to have a look at the shoulder while I have you. This position just makes it a little easier. So just looking for scapular symmetry. Having a look at the clavicle and chest wall as well, all of which is midline. No signs of asymmetry there. Having a bit of a look at the scalp and surrounding hairline. So far, no signs of discoloration. Scalp color is clear, slightly pale, which is normal due to protection from the hair from UV exposure. So consistent. Do you typically part your hair in a certain area or just kind of let it fall naturally?
Usually it's in the middle, but I think today it just kind of fell naturally.
Okay, so I do just like to have a look. If my patients tend to part their hair in a certain area, I like to look at the part. Just see if there's any signs of abnormal hair loss or excess sun damage, but that looks okay. Alright. You keep your eyes closed for me. I'm just going to turn your head here slightly. I'm going to have a look at the brows and lashes. So I just have a little spoolie. It's going to allow me to brush through. That looks normal. I'm not noting any flakiness of the skin, no excess dryness of the brow. Also no hair loss upon manipulation, which is a good sign. And brows are fairly symmetrical and even. No signs of hair loss or patchiness anywhere. So just gonna have a look at the lashes. Might be just a little ticklish here. Your lashes are very, very full. Nice and even. Not seeing any signs of infection or folliculitis, no abnormalities at the base of the lashes. Very good. So I'm just going to use the same spoolie to gently brush through this front portion of your hairline. Just allows me to manipulate any potential areas of patchiness. I'm going to go through and have a look here. There's a couple different sections at the front of the hairline. Very good. So far, nothing notable. Alright. That looks okay. Just going in with my comb and a pair of tweezers. I like to just kind of single out a few strands of hair. This allows me to check hair integrity, follicle strength. Just a gentle tugging at the hairline. I'm not noting any signs of weakness or an excess of elasticity. I just have some little silicone fingertips here, and I'm just going to use this to very gently assess skin texture along your face. So the little nubs allow me to very gently manipulate the external lipid layer here, see if there's any signs of excess dryness, any flaking, any signs of loss of elasticity, which I don't expect to see as someone your age. You're very young, but it's always good to check. So just doing a very gentle stretching of the skin, checking for reactivity. Pressing down in some areas allows me to see how long it takes for plumpness to return. Alright, having a look at the lips as well. No signs of excess dryness, very well moisturized. So I'm going to do a couple of things, Samantha. I did notice just a very small amount of kind of dead skin or debris at the external ear. So I have a little bit of a cotton kind of feathery wisp that will allow me to clean some of that up for you. And I also want to have a look at the upper extremity, do a bit of an assessment of your skin. How about get your arms a little bit closer, okay?
Okay.
All right. So give me just 1 second. So just coming in to have bit of a look at your ear. Like I said, you just have a little bit of external debris, which is totally normal. It's just something for me to have a bit of a look at, and I can do some cleaning here. So I'm going to start with just a Q-tip. Dislodge some of that dead skin. Might tickle just a little bit. You're just going to feel a little, kind of feels like a feather. This just allows me to grab up any of those skin cells that are hiding in these smaller corners. Okay. And then lastly, I'm just going to blow away any last little bits that I might have missed. That looks a lot better. All right. So we'll do the same exact thing to the other side. So just coming and having a look at the other side. And this side is very similar. I did notice just a little bit of that debris and dust or dead skin cell here. So I'm going to do the same thing. I'll start by having a look with my light, and then we'll do a bit of a cleanup. So just have a look and see. Really externally everything looks fine. It's just here at the mid-ear that I see some of that debris. So go ahead and just clear some of that up for you. Adjust your hair here a little bit. Good. This just grabs up all of those little skin cells that like to cling on. Alright, and then of course I'm just gonna blow away any last little bits here. A lot better. All right. Okay. All right, Samantha. So, just gonna have a brief look at your arms, upper extremities, see if there's anything of concern here. Obviously, we use our arms quite a bit, so I do like to just have a look, see if there's anything concerning with your skin. I do see a couple of freckles here. Skin texture is very even and flat. A little bit cold to the touch. Are you cold?
Just a little bit.
It's fairly cold in here, so I do apologize there. But that is okay. A couple of freckles on the hand as well. I see one small scar here. Just noted earlier, fingers are well groomed. No issues with the cuticle there. Another little small scratch there. Fingers again are just a tad cold. Let me have you squeeze my hand for me. Squeeze hard. Good. Okay. No issues with your fingers or joints or anything of it?
No.
So if you stretch your fingers all the way out for me and squeeze all the way in. Good. I'm just going to test some mobility here at the elbow as well. That's good. Alright. Look at the musculature here at the back of the scapula. Nothing notable there. Alright. Okay, very good. So I'm going to go ahead and come around. So coming on to your left side, I am just going to do the same thing. Now remind me, Samantha, are you left or right-handed?
I'm left-handed.
Left-handed, okay. Okay. This side feels just a little bit warmer. Could be just the draft is coming from that side of the room. It's not particularly concerning. I do see a little bit of a bigger mole here at the finger. Is that something you've always had?
Yeah.
Okay. So just something to look out for with moles. You more so want to look for signs of asymmetry. Round and circular is usually fine. If you notice any changes or any abnormal ridges, if you see one that's round and it starts to change and has more squared off ridges, that could be a little bit concerning. Consistency and color is very important as well. So this one is pretty solid brown throughout. There's no like blacker spots anywhere, which would be cause for concern. So do recommend performing your own skin inspections at home. It's something good to stay on top of, especially if you're not seeing a dermatologist more regularly. So, particularly areas that are more exposed to the skin. However, obviously moles can develop anywhere. So you also want to have a look at areas of the body that are typically more covered. Okay. Again, there's no issues with your mobility. No rigidity of the joints, which is good. So I'll have you do the same. Stretch your hand out. And bring in. Good. Okay. Musculature of the upper body is good. See this hand for just a second. You are just a touch colder here. Maybe squeeze with your left and then with both. Okay, so strength is equal, that's fine. Okay, go ahead and relax your arms for me. I'm just gonna have a look at your throat while I'm up by your neck. I'm just gonna palpate slightly around the thyroid, checking for any signs of distension, which is not notable. You ever have any pain or notice any swelling of the neck or lymph node area?
No.
That looks okay. All right. So I'm going to rest your hands at your side for me for just a second. I'm just going to do a very, very brief palpation of the upper abdomen. Just want to feel for any signs of distension here. Any issues with digestion or anything?
No.
All right. All right, Samantha, so I will have you sit back up on the table and we can conclude.
Okay.
All right, so So we've concluded your examination. There was nothing super concerning that I noticed. You don't typically have any abnormalities when you come in for your annual visits, which is good. So you're consistently healthy, which is what we like to see. I did notice just a little bit of that dry skin of your ears that I was able to take care of, so that's no big deal. Nothing concerning with your skin at all. Your hair is very healthy, very thick, nice and full. Upper extremity strength is well intact. Bit of a temperature variation there of the arms, but I do think it's just because the draft kind of comes from the right side of the room, so nothing particularly concerning there. Now, we didn't have a look really at the lower extremities, but you said there's nothing concerning happening there?
No, nothing like that.
Okay, no back pain or anything? Okay, so I'm going to do one last test here. I want you to just turn at the waist for me, so just rotate, and then this side, and then I'll have you just bend forward and bend backwards, and nothing there as well. That all feels okay. Okay, all right. Well, I would say you are likely good to go until your next annual visit. I would like to have you back in about a year unless anything were to change.
Okay, sounds good.
All right, well, thank you so much. I hope you get
you.
home safely. I'm like, am I in the frame?